Morning, guys. This is the second lecture in Chapter 10, and this lecture, Chapter 10, we're still covering appointment scheduling and patient reception and processing. But with this chapter, this lecture, we're really going to get into special considerations when scheduling appointments, patient reception, and processing. So with this chapter, you need to be able to do the following related to special circumstances and scheduling. You need to be able to discuss several methods of dealing with patients who are consistently arrive late, which is actually going to be part of your homework assignment, so pay attention to this one. Recognize office policies and protocols for rescheduling appointments. Discuss how to deal with emergencies, provide referrals, and patients without appointments. We'll need to be able to discuss how to handle failed appointments and no-shows, as well as methods to increase appointment show rates, and discuss how to handle cancellations and delays. We need to be able to discuss patient processing, including the importance of the area they come into, the reception area. You need to be able to describe how to prepare for patient arrival, including patient check-in procedures. Explain why using the patient's name as often as possible is important, as well as how the medical assistant can make patients feel at ease. And then describe the registration procedures, including and obtaining patient history. And then we need to be able to do the following related to patient reception and processing. We need to be able to show consideration for the patient's time, properly treat patients with special needs, escort and instruct the patient, and then describe where health records should be placed. And then to close out, we need to be able to describe how the medical assistant should deal with challenging situations such as talking to patients, children, angry patients, and patients with relatives and friends. So we're going to talk about a lot today. There's quite a few slides we've got to get through, and there's actually some more here that we got to discuss. And that's the friendly farewell, patient checkout, and planning for the next day. And then we need to be able to discuss patient education as well as legal and ethical issues for scheduling appointments and patient processing. So there's a lot here, guys. We're going to cover a ton. This is a huge section in your CMAA exam. So there are a lot of questions on your Chapter 10 test. So really, guys, pay attention to these lectures. Take as much as you can. Use your note sheets. Really try to grasp and understand all these concepts. If you have any questions, please feel free to ask me. So we're going to get started with late patients. We're going to talk about, at the beginning here, we're going to talk about different challenging scenarios that come into the office, and one of them is late patients. So emergencies and small delays can happen to anyone, all right? But a patient who consistently arrives late can put a strain on the office and the practice, okay? So for habitually late patients, that means patients that are late all the time. Scheduling them for the last appointment of the day means that if they arrive after closing time, there's no obligation to treat them. So that is one method to kind of handle a habitually late patient. So some tell habitually late patients to arrive 30 minutes before their appointment time. So for example, if they have a 2 o'clock appointment, telling them to arrive at 1:30 will kind of give you cushion for that habitually late patient. Make an attempt to work with patients who have occasional difficulties arriving on time. It happens, guys. Everybody will show up late at some point in time, all right? And you still have to treat them. Okay, you have an obligation to treat them. It might affect the schedule a little bit, but you should be able to make some changes and adjustments and work with them. But don't let the schedule be disrupted by consistently or constantly late patients. Again, use those techniques that we just talked about to make sure that they get there on time. You need to be able to reschedule appointments, guys. So unexpected conflicts will cause patients to reschedule. Maybe something came up and they have a child that's sick at home. They can't make their appointment anymore, something along those lines. So you should be able to, it's going to happen. You got to be able to work with them and reschedule them. And one of the most important key things to do there, guys, is to remember to remove that first appointment from the schedule book when you are rescheduling them. Okay, you don't want to have them on the books for two schedules, or for 2 appointments, sorry. So failure to remove that first appointment from the schedule will result in the patient being expected in the office on 2 days, and time will be wasted with calls and follow-up, and they won't be there for one of those appointments, so you're really wasting a time slot where another patient could fill it. Emergency situations. Emergencies are one of many reasons it is helpful to have some time blocked down the schedule for unexpected visits. Okay, so you'll have emergency calls that come in, and those calls will go through a screening process, and that will basically prioritize them so that the emergencies see the provider first. You might also have to send them to the ER or call an ambulance for them if they're in that case of an emergency. So screening those calls is very important, and it requires experience and tact. It's very similar to what we do in the switchboard room, but in the medical office, it's a lot more focused to certain questions and really making sure that they're healthy and finding out how much of an emergency it truly is. And emergencies can be emotional as well as physical crises, so it's important to be able to handle those with tact, stay calm, and provide that best customer service to that patient who is in need. Patients who are actually ill should be acutely ill, not actually. Patients that are acutely ill should be seen the same day. Now, what I mean by acutely is it happens all of a sudden. Okay, all of a sudden they wake up, they're feeling great. A couple hours goes on, they're miserable, they can't move, they're throwing up. Those patients need to be seen the same day. Okay, urgency of calls is determined by a list of questions prepared for reference. All right, so the provider should help with that list of questions, and he or she should determine what is considered an emergency, which is a life-threatening situation, or which is considered urgent, which is serious but not life-threatening. Okay, those are two different things. It's important to know the difference of them. So the patient may need to go directly, and may be directly referred to the emergency department if it's that much of an emergency, if it is life-threatening. Never place an emergency call on hold and stay on the line until EMTs and other helps arrive. Okay, and that's just plain and simple. You want to provide the customer and that patient and that person, not just a customer, that person. You want to treat them and care for them in their time of need. You never want to, somebody calling you saying they're acutely ill and they, on the edge of death type of thing, and you don't ever want to put them on hold or hang up that call from them because you never know what will happen to them. And obtain a phone number, a name, and a location at the start of the call, so that if they ever become unconscious, your call gets disconnected, you can do that, okay? That way, you're always on top of things and you have it there for them. Provide a referral. So most offices honor requests from referring providers who ask that the patient be seen the same day. So if you work at a doctor's office and another doctor's office is referring a patient to you, you should accommodate that physician and their referral as you can, okay? And don't let it disrupt the schedule, but try to accommodate for them. And it is important to keep the schedule that is not intolerant to that type of request, because they are going to happen. So don't create a scheduling type or book yourself so full that you can't help those requests out. You'll have patients that show up without appointments, okay? So providers must agree to a policy for patients with no appointments, okay? And medical assistants must follow through with that policy that they create. You might have to simply just turn down a request, okay? Maybe you're too booked and office policy says you can't do it, so you might have to turn that down. And it's important that you do that with tact and courtesy for that patient, okay, and understand where they're coming from. But regardless, you have to follow established office policy, okay. Patients requiring immediate attention should be accommodated somehow. If somebody shows up into your office with a gunshot wound, okay, and they walk in off the street and they've been shot and they walk in, you're not going to say, hey, we can't help you out here, I'm sorry. You should accommodate them and treat them as best you can. If immediate care is not needed, a brief visit with a provider and a scheduled appointment for the problem later on will often solve the problem that they're having, and it will kind of stop it right there. So that's one technique or tactic that you could use in that situation. Failed appointments. So a failed appointment is when you schedule an appointment and the patient just doesn't show up. It could be like a no-show. They don't make their appointments. So there are many reasons why patients fail to keep their appointments. It could be forgetfulness, all right? And once you detect that a patient is forgetful, form the habit of telephoning or emailing a reminder the day before the appointment. You should do that for everybody, but especially for patients who are forgetful. Automated call routing offers the patient the option of canceling the appointment when you call them. So even if they're forgetful, you still give them the option to cancel or to keep their appointment, confirm their appointment with automated call routing. They could owe money to the office, okay? Many patients have every desire to pay for their appointments and their needs and their services that you've rendered, but they can't afford to and they feel embarrassed about their situation, so they avoid their appointments, all right? It's important to work with your patient, discuss office policy in regards to payments and co-pays and insurances and stuff like that, and being upfront and maybe setting up a payment plan with them will help them not fail to keep their appointment. And then they could be just in denial about their condition. I'm not sick, I don't need to go to the doctor type of thing. But it's important to determine the reason for the failed appointments and then to remedy that situation. So figure out what's going on and then remedy that situation. If patient's health is in jeopardy, you need to send a letter by certified mail that explains the need for them to keep their medical appointment and to show up, okay? And then it's also important that you keep a copy for that medical record, because if they ever take you to court, guys, saying, hey, I was sick, they never did anything for me, you can show, hey, we tried to get you in here, we told you the severity of what is going on with you, you just failed to keep your appointment. So it's important that you have that. And then you need to have a no-show policy, okay? So a busy practice must have a very specific policy on appointment no-shows, and you must enforce it effectively. So some patients don't realize the importance of keeping their appointment. They're just like, oh, I can just reschedule and get in there another time. They don't understand what it does to the medical practice. So maybe educating them based upon that will help as well. So a patient who does not arrive is known as a no-show. And your policy must be established and enforced. So note the first time the no-show that the patient no-shows in the patient's medical record or even in their ledger card, okay, which we'll talk about later on in chapters future. On their second no-show, warn the patient, and then the third no-show, consider dropping the patient because they are affecting the medical practice and they are not holding up to their end of that physician-patient relationship contract. A provider, if they fail to no-show, they may wish to charge the patient for no-shows or rescheduling appointments. Okay? Office policy manual must state that patients are not charged for showing up, especially if the slot could not be filled. Office policy manual must state that patients are charged for not showing up, especially if that time slot cannot be filled. So because the time slot was scheduled and the provider was ready and able to treat the patient, it is ethical to charge the patient for that missed appointment, especially if he or she did not call to cancel it or reschedule it. So it is ethical to charge patients for a no-show appointment if they failed to call in and cancel and reschedule them. But be understanding when possible. But don't let a patient take advantage of the provider's time, okay? And it's always important to make a notation in the patient's medical record and in the appointment book or database, just so you know and you have all the documentation. You need to document everything that happens in your medical practice. So this is just another situation of that. Automated call routing. We talked about it a little bit earlier in this lecture, but this is a great tool for you guys as medical assistants, and it will save you a ton of time in your practice because everyone benefits from a full schedule of kept appointments. Okay, everybody benefits. The patients are getting seen by the doctor. You're keeping busy at your job, and the provider is seeing a ton of patients and bringing in money for the office. Okay, so automated call reminders can contact patients and schedule for appointments. All right, and patients are then asked to press a certain key on the phone to confirm their appointment, and then a different key to cancel their appointment. So this same tool, this is a great tool. Okay, it saves you from having to call the patients to say the same spiel to everyone and confirm it. All right, this is like an automatic system that calls out to them, and they can either cancel or keep their appointment by pushing a button. All right, this is fantastic. The same tool can be used to send messages to patients, introduce a new provider to the office, or announce the availability of new procedure. Okay, this is a really great tool to get out to your patients without having to physically make that call. So whenever you're scheduling appointments, appointment reminder cards are key. Now examples of these, I know they're hard to see up here, are on page 162 in your textbook. All right, so most healthcare facilities use appointment cards to remind patients of scheduled appointments and to eliminate misunderstandings about dates and times. So it's important that you make a habit for reaching for an appointment card while writing an entry in the schedule book. So every time you write into the schedule book, you're filling a time slot, it's important that you reach at the same time and grab an appointment reminder card so you can fill it out that matches the appointment book and give it to that patient. So after the date and time have been written on the card, just double check it with the scheduling book or the system to make sure that both entries agree with each other and so that they're not being told a different time than they are in the schedule book. Confirmation calls. So many individuals now have home phones, work phones, cell phones. There's millions of ways to get in contact with somebody. However, they may want calls from the provider to go only to their home phone, or only to their work phone, or only to their cell phone. Okay, so it's important that you know which phone number the patient prefers you to contact them on. Okay, the preferred phone number can be highlighted in the medical record or on the computer. That way you can just easily access them and give them that confirmation call. There are privacy guidelines and standards that require care when leaving patient messages for reminders. You never know who is on the other end of that answering machine or that voicemail box. Anybody can have access to that. So you have to be very careful when you are leaving reminders about appointments on their phones. So a patient can sign a release form so that the office staff may contact someone else to leave messages or reminders. All right, but you have to make sure that in order to do that, you have that signed release, or if not, that's a HIPAA violation, and you breach that patient's confidentiality. Email and mailed reminders. So many computer scheduling programs can send an email to patients the day before an appointment as a reminder. So automated emails are a great time saver for the office staff because no time is taken to perform this task other than the original scheduling of the appointment. You can have it set up so that as whenever you schedule that appointment one day before, that their appointment actually comes up, that email is going out to confirm that they are actually going to be there. So the office staff may mail reminder cards to the patients. Okay? A simple way of handling mailed reminders is to have a supply of postcards on hand, and while the patients are still in the office, have them write their name and address on the postcard, then place the card in the tickler file under the date that it is needed to be mailed. Okay? So this takes a little bit more time, not terrible, but it's a little bit more of a task for us as medical assistants. Patient who is due for an appointment but has not yet arranged a date and time may be sent a reminder as well. Okay, so they need an appointment, it's coming up, they just don't have one scheduled, you can send an appointment reminder as well to try to get them to come back into the office and to make an appointment. So you're going to have instances when the patient will call and cancel. We've all done that, we've all canceled appointments. So it's important to keep a list of patients with advanced appointments, which we talked about last lecture, who would come in sooner if an appointment opens up due to a cancellation. So they need an appointment down the road. They would get in the first available time slot. Patient calls and cancels on the same day. Give a call to the person on the list to see if they can fill that time slot so you still have a full schedule. Okay? So by keeping that list of patients willing to take the first canceled appointment, the medical system can readily identify which patients to call to fill the vacancy. All right? And note each cancellation in the patient's medical record with the reason if possible. So if the patient simply reschedules an appointment, a notation does not need to be made in the medical record unless a pattern develops that might be significant to the patient's medical treatment. All right, so just remember that. Skipped one. So sometimes the provider will be delayed, either getting to work, or they'll be delayed with a patient, or something along those lines. So show concern for those patients that are waiting, but don't overly apologize, which might imply that some degree of guilt. Be understanding, be sympathetic, but don't overly apologize because you don't want to take on any guilt that is unnecessary. So call patients and suggest that they come in later if an advance notice of the delay is known. All right. So if the doctor gets called out for surgery, call the patients that are in the future appointments for later on in that afternoon and let them know, hey, Dr. Jones is actually going to be delayed today. Would you like to reschedule? We'll push your appointment back. If patients have arrived and they're waiting in the waiting room for the patient, let them know of the delay and explain it was an emergency. And if delays happen often, maybe you should consider a different scheduling system that will better accommodate those delays. So when the provider is called to an emergency. So providers frequently have emergencies and most patients are understanding. It is particularly important to have a daytime telephone number of each patient available so that the appointment can be rescheduled if they have to make that call to the patients. So tell the patients that they can wait or reschedule for another day, and then quickly call the patient scheduled for later if the appointment is scheduled as affected to cancel before their arrival. That's why having that telephone number is essential. It can make it really easy for you guys. Sometimes the provider is going to be sick. Okay, the doctor is going to call in sick, or they might be out of town. So it's important to inform patients scheduled of the provider's illness. Okay? However, the provider is still a patient in a sense. Okay? He still has a right for privacy. So you're not going to say, Dr. Jones is out with bronchitis. You just, breached his confidentiality and, did have a HIPAA violation there. So if the provider is called out of town, appointments must be canceled or rescheduled. So typically, other providers will help provide care during absences, and the patient should be given a name of another provider or a possibility of a choice of several who will provide care during such absences. And then, for security reasons, state that the doctor is unavailable, not that they're out of town. Okay? And what I mean by that, saying over the telephone that the provider is out of town could lead to attempted burglary or unauthorized intrusion on the premises or something along those lines, since they know that, hey, the doctor is not there. That it could lead to different security issues down the road. So patient processing. So now we're getting more into so we did just a bunch of different special scheduling considerations. Now we're going to get into some patient processing stuff, taking in patients when they show up for their appointment, and then sending them away with a friendly farewell. So when the office staff is committed to making the patient feel welcome and the focus is on care of the patient, success of the practice is inevitable. It's going to happen. If you are a patient-focused office, success will be inevitable. The reception area. Now, as administrative medical assistants, that is our area. And it should always be an inviting place. The patients that come in, they need to feel comfortable. They don't want to walk into a reception area to go into a doctor's office where they're either sick, ill, or injured, and they don't want to and feel uncomfortable and uptight. That's not a good vibe for you. So visits to the provider can be in times of great stress. That's why it needs to be comfortable for them. Patients have a choice of healthcare providers, and when the patients have good experience, they are likely to tell others, which in turn will bring more people into the office and drive your practice to success. So the reception area, like I said, this is your area. Okay? So the first impression of the office is a lasting one. All right? You guys make the first impression of the office. You're the first person they interact with. Okay? You're the first person they see. And the reception area is the first place they kind of sit in and relax in. So it's important to select comfortable furniture and have good lighting, to provide magazines to help pass the time. Maybe a writing desk or a computer for patients to use is a nice touch. It's not a need, it's not a necessity, but it's a nice touch. So periodically take a look around the reception room and assess its needs. Keep it clean, keep it tidy, keep it neat, because that is what patients base their first impression on. So you need to prepare for the patients to arrive, especially if you are not working in like a walk-in clinic or an emergency department. You have a schedule of when the patients are going to show up. So advanced preparation helps the day go smoothly, and that includes preparing health records. So it's important that you pull the medical records of the daily patient's appointments. Okay, you just pull everybody that's on the schedule, get them in an order, and make sure that their progress note, they have enough room in their health record for any updates, and that the progress note section is full. And then the patient comes to check in, and it's important to use a sign-in process that promotes privacy. Okay, and take the steps to protect other patients in the reception area. So make sure no health records are on the reception desk so that HIPAA can be followed. And one of the first questions that must be asked is if the patient has traveled to a country with widespread transmission or uncertain control for Ebola. If the patient answers yes, he or she should be isolated immediately. This, now, not necessarily just Ebola, but this is for like anytime there's like an epidemic and a breakout of some sort. You're dealing with the health and wellness of the community that you're serving. So you need to make sure that if somebody comes in and they come in from an outside country after visiting where that epidemic is happening, you have to treat them with certain and special care. So greeting the patient. This is the first thing that you guys are going to do. So every patient has the right to expect courteous treatment. And it's important that you greet the patient by name and use the patient's last name and title, so like Mr. Jones or Mrs. Smith, okay? Unless the patient insists on you use their first name or if they prefer a nickname. So the first time they come into the office, you're going to use their last name and their title. So Mr. Jones, Mrs. Smith, something along those lines. But when they become more comfortable with you guys, maybe they just prefer to be called Nancy or something like that. So some electronic health records allow for the patient's picture to be added. That way you can actually greet them before they introduce themselves, which is always a nice and courteous task, because it feels like, hey, they actually know me already, and they know I'm here for a reason. So patient interaction, guys, this is key. Okay, this is something that we really need to focus on and be proficient and excel at. So medical assistants should make patients feel at ease. They're coming in there for something, most generally people don't go to the doctor's office because they're feeling fantastic and they, expect great news. So patients like to be acknowledged when they arrive. Always acknowledge their presence. If you're busy or on the phone or dealing with another patient, maybe just a look up and a wave, or I'll be with you in a second type of thing will provide that acknowledgement as well. By using the patient's name often, the medical assistant makes the patient feel comfortable, and it also ensures that the correct patient is being treated. So sometimes make brief notes in the record about current events in the patient's life. So having brief chats about events in the patient's life confirms that the staff members actually care about the individual patient, and it also helps get an insight to really what's going on behind the scenes. So the registration process. So on the patient's first visit, the first time they ever walk into the clinic, the staff follows registration processes and patient information, and that's giving them a patient information or a registration form and having them fill it out. So this is just things that will be on every single registration form. You know, their name, their date of birth, their address and telephone numbers, their job, their name, address, telephone numbers of their spouses, where do they work, their social security number, their driver's license, their nearest relative, and any referral if necessary. So you guys need to know how to fill out these forms correctly, and you should be able to answer any question on these forms or about these forms. And when the form is returned, it should be checked carefully by you guys to make sure that it's completed, and then you can put it away into their either your electronic medical system or their health record. So if this is a new patient, he or she will have to sign the facility's Notices of Privacy Practices document. So some practices have the registration paperwork on their website so that the patient can just get all the pre-registration or pre-visit paperwork done and bring it to them. So a patient's personal, medical, and family history should be obtained by asking him or her to complete a questionnaire, and that consists of everything. Okay, so that questionnaire can be written or it can be electronic, but it's important that it gets completed so that you have a good outlook of that patient as a whole. Showing consideration for the patient's time. Now this is a scene that you might see quite often in your medical practice, but it's one that you really don't want to see a lot. Okay, so the patient expects to see the provider or practitioner at the appointed time. Any delay longer than 10 or 15 minutes of them sitting in the waiting room like this should be explained, and then even offer them to reschedule if the wait is taking too long. So some patients are patients with special needs. Okay, some patients are physically challenged, some are very ill, and some are uncomfortable. All right, so you're going to be dealing with a wide range of a diverse population. Okay, you might even have language or cultural barriers that may exist. So it's important that you observe the patient's appearance and behavior, and ask the patient if they need assistance, and how you can actually help them. Most generally, if they need help, they will tell you how you can help them. Now, this slide here is more for the clinical medical assistants that do both back office techniques as well, but you might be asked to escort and instruct the patient as well. So most patients prefer to be escorted than simply told where to go. So if you're taking them to a waiting room, or you're telling them that they need to go to a certain exam room, it's best that you escort them. So take the time to escort the patient personally to the appropriate examination room or treatment. Do not point to the room and expect the patient to find the way. This also helps with HIPAA compliance, because you are ensuring that they're not peeking into other rooms or looking through files or something along those lines. So when you're going to get that patient to take them to a certain room, pronounce the patient's name correctly. Make sure you know how to say the patient's name. Know and explain the office policies on family members and friends in the examination room. Most generally, most offices will allow it, some will not though. Uncertainty about the way things are going creates anxiety for the patient, and that's not what we want. We want to remove that anxiety, okay? Health records care, okay? Health records should never be left on an examination in the examination room to be picked up and read by the patient. So oftentimes file folders are located in the back of the examination room doors. So the health record can be placed horizontally in the patient's record if the patient is ready to be seen. Once the physician has gone in and saw them, okay, the physician will set it vertically most times as a cue to other office staff that this patient has already been seen and we are ready for the next steps. So with an electronic health record, log out of the computer when you're ready to leave the room. All right, if you're in there getting up stuff for the patient and on the computer, and you go to leave the room, make sure you log out from that emergency or lock the computer so that the patient can't get on and see different things. So some offices will use a call-out system instead of the file folders being placed in certain ways, so that you are all aware of how the office is run. So the office should develop a method that allows the most efficient use of time, provides high quality care, and protects patient confidentiality. Now let's get into some difficult patients here. You're going to have patients that are talkative. So the medical assistant can spot a tendency in the initial interview. If they like to talk, you should be able to notice that. Patient's history can be flagged to alert the provider that, hey, this is a talkative patient. And one technique could be booking them at the end of the day, kind of like a patient that shows up late. So by booking talkative patients at the end of the day, it doesn't get in the way of other patients' times. So that is just one technique. You're going to have patients with children. So usually, the parent or guardian accompanies the child into the examination room. However, some exceptions do exist. And in cases of like suspected child abuse, a parent or guardian may not accompany the child into the examination room. And sometimes older children can see the doctor without a parent, but consent to treatment is needed. So you still have to get consent, but you can send that child in without a parent as long as you have that consent. So parents are responsible for the children's behavior while at the provider's office. That includes the waiting room and the reception area as well. So medical assistants should never discipline a child. Instead, address the parent about children behaviors. You can have angry patients in the reception area. Maybe their time is taken up too long to get into their appointment, or maybe there's something going on with their bill, something along those lines. So if it's possible, invite the patient into a room out of the reception area. That way they're not sitting in the reception area steaming and affecting other patients' visits there. So present a calm attitude and speak in a low tone of voice to people who are angry. Under no circumstances should the medical assistant return the anger or become argumentative. And there should be a policy in place for dealing with potentially dangerous individuals as well. Some patients will have relatives and friends with them. So the medical assistant should sidestep any discussion of the patient's medical care in front of family and friends. Okay? That's not really any of their business. It's important that you avoid a too casual attitude around them. So do not say things like, I'm sure this will be nothing to worry about, or something along those lines, okay? Show moderate amount of concern, and then health information cannot be released to anyone without the patient's consent. If they're asking them to come into the treatment room with them, that is their consent saying, hey, it's okay that they be part of this medical discussion because I'm inviting them into these rooms, but still try to avoid that too casual attitude regardless. And then we gotta give them a final and friendly farewell when they leave the office. So whatever words of goodbye you choose, all patients should leave the facility feeling that they have received top quality care. So if the patient needs to return for another visit, the medical assistant can say something like, hey, see you next week, or something along those lines. And then treat the patients with courtesy, respect, and friendliness as always. So when they're checking out, they come back to our desks, the administrative assistant's desk, and it's our job to greet the patient with a friendly smile, and again, call the individual by their name. You need then to check the health record to see if the provider wants the patient to return. And then if they do want them to return, make any return appointment scheduled. Be sure to thank the patient for coming in and wish the person well as they leave the office. Okay, so we just went from very beginning of the day, we're taking patients in, and now we sent them out. Now we need to get ready for the next day, so we start planning for it. So it's important that you review the medical records for the scheduled patients for the next day. And then if there's any laboratory tests or other procedures that were scheduled on the patient's last visits, determine whether the reports are available so that you can fill their health record and have the most up-to-date information there. Make sure everything needed for the procedure is on hand and available, and then planning for the next day can save many precious moments of time during that next morning. So in closing, all right, an office that runs smoothly and stays on schedule indicates professionalism and competence and is greatly appreciated by all those who come in contact with it. A person in charge of scheduling has a huge impact on the office efficiency, so being good at your job is essential. Having a friendly, helpful attitude and ability to make compromises is key because every day is going to be different in the office. Okay, you're going to be faced with different situations. Being able to work through all those with a friendly and helpful attitude is essential. So patient education. Educating the patient about office policies helps the facility run smoothly from day to day. Maybe it's an information booklet about office policies and procedures that you give to the patients. If the facility offers internet-based appointment scheduling, the patients have to be educated and taught how to use that system. So it's important to choose a simple, user-friendly program and have a special phone number for patients to call with their questions about the program. And then finally, legal and ethical issues. The appointment schedule can be subpoenaed to court as a legal record. So it's important that everything, all your handwriting is legible and all the information is correct